What is immunotherapy? Put simply, immunotherapy is a way of utilizing your immune system to fight cancer in ways that it couldn't before. So then, what exactly is cancer? Cancer is a general term for the unregulated division of abnormal cells in a given part of the body. As we know, cell division is a normal and important part of life, and all organisms must be able to perform cell division in some way in order to reproduce. However, when this reproduction gets out of hand, dense groups of cells in one area of an organism, called tumors, can be formed. Left unchecked, tumors can cause major problems in the local organs, and if they are malignant, meaning able to invade adjacent tissues, can spread throughout the entire body, eventually proving fatal. Cancers can be formed in many ways. The most common method, however, is through mutation. Mutation can occur randomly during cell replication, or can be caused by the alteration of genetic code due to an outside mutation-causing agent, called a mutagen, for example, ultraviolet radiation or smoking. Some of these mutations can lead to excess reproduction of cells and aid in the formation of tumors. Some people can also have a natural predisposition to cancer, and the severity of it once developed. Certain common genes, if overexpressed, can increase the likelihood of developing cancer in many areas of the body, such as the head, neck, and bowel. If cancer is developed as a result of an overexpressed gene, it tends to be much more invasive and progressive, with a worse projected outcome, or prognosis, according to sialic acids in squamous cell carcinoma of the head and neck. If malignant tumors are not treated in any way, fatality rates are 100%. With treatment, however, as visible in the graph, cancer survival rates can be as high as 90% with modern methods, and many patients fully recover. The trouble of fighting cancer comes largely from the formation of metastases, or tumor cells that migrate from one area of the body to another through the blood vessels and/or lymphatic system. After the cancer has spread past local lymph nodes, it is almost impossible to treat with surgery and cannot be beaten through the use of other modern methods. However, by utilizing immunotherapy, we are able to unmask cancer cells that are hidden from the immune system across the body and let natural killer white blood cells attack the tumors on their own. The use of this technique is known to greatly increase the survival rate of patients with melanoma, skin cancer, renal cell carcinoma, kidney cancer, and non-small cell lung cancer, according to Dawn Brooks, an oncologist at BMC. Immunotherapy has been used throughout history, dating back to 2600 BC, when Egyptian pharaoh Imhotep purposely had bacteria introduced to the tumor site by incision, allowing white blood cells to combat the infection. Through this process, many tumor cells were accidentally killed, and the cancer went into regression. This method was later used on St. Peregrine in the 13th century, and became commonplace in the 18th and 19th centuries. Obviously, this method had its flaws in that the patient had to be exposed to potentially fatal infection in order to combat the tumor. New research in the world of cancer has revealed that tumor cells hide from the immune system by coating themselves with sialic acids, a combination of proteins and sugars called a glycoconjugate, which are used in many organisms to identify cells as native to the body. If a receptor on a natural killer cell, called a Siglec, binds to one of these molecules, the cell is deemed native to the body, as written in Cancer's Sweet Cloak. Secondary functions of sialic acids have been found that aid in the formation of metastases by cells repelling other cells with large amounts of sialic acids. This means that the more sialic acids present in a tumor, the better it is hidden from the immune system, and the more likely it is to spread. The method by which these glycoconjugates are synthesized and attached to the outside of the cell can even affect how dangerous the cancer is, according to sialic acids in squamous cell carcinoma of the head and neck. Current immunotherapy techniques are focusing on removing these sialic acids in order to allow the immune system to recognize abnormal cells and dispose of them accordingly, as well as prevent the tumor from metastasizing. New cancer-fighting drugs are being developed every day to utilize this method, one of which combines a bacteria-derived sialic acid-cutting enzyme called sialidase and a commonly used antibody in breast cancer treatment called Herceptin to deliver the enzymes directly to the breast tumor cells. The sialidase then cuts the sialic acid from the tumor cells, in a sense marking them for destruction, as outlined in Cancer's Sweet Cloak. As previously stated, a metastasized tumor is comprised of cells from the original tumor, meaning that a metastasized breast tumor in the liver is still made of breast cells. Because of this, the ability to target oddities of a certain type of cell with antibodies rather than a certain area of cells could lead to the recovery from metastatic cancer. These methods have not been FDA approved yet due to the fact that the foreign enzyme can cause an autoaggression reaction in which the body attacks the foreign substance. However, Newer versions of the drug are being developed with human-derived C. elidase to prevent this. If approved, this type of drug could allow cancer to be fought and cured much more effectively. Clearly, the field of immunotherapy has come a long way, and still has a long way to go. But if these methods are not knocked down by the government, then the cure to cancer may be much closer than previously imagined.